I'm Raman. One of the important things is that I'm not a specialist of the subject. I'm more of a practitioner. I got trained into public health after doing a lot on these lines. So I've been traveling or co-traveling with several development missions of India, working with governments, working with civil society organizations, government civil society partnerships, so on and so forth. And now my current affiliation is as of the program here it is two, but otherwise it is many. So I'm the national convener for the Public Health Resource Network, which is a group of individuals and organizations that are trying to understand and address the public health issues in the countries. As a work, I am heading the Center for Budget and Governance Accountability, which is a New Delhi based think tank. So many of the specifics that is going to come here from the initial topics that we have already covered, we are going to slightly shift into the societal part of food insecurity. From knowing it, measuring it, looking at what are the consequences. As it is written, it is multidimensional. The consequences are, and that is where food security, not only discussing them, but understanding them and acting on them is important. When we say multidimensional, I'm quite sure, not only hopeful, that the people gathered here from various backgrounds, because I was looking at the Excel sheets and the kind of expressions of interest that many of you have written while enrolling for this course. It's quite, giving me hope. One of the reasons that I'm here is also that this mix of, from the youngest to some of the senior minds together are trying to understand and crack one of the major problem that is worrying India and moving India. I'm limiting to India at this point, but some of my discussions will also go out and pick up some global context. So let us look at this multi-dimensional nature. So I'll go to the origins before I go to the consequences. So one is the production part of it. The food production is not adequate. Related to that is, which is Jasmine was talking about in detail, is food wastage as well. So food production has several determinants like the climate change, disasters, environmental degradation, food and agricultural as well as economic policies. All these can influence food production, and the inadequate production we are facing currently, which is leading to food insecurity to some extent. Because I'm saying some extent because countries like India has put in a lot of efforts over the last, if you see the history of 40, 50 years, whether it is green revolution, whether it is white revolution, several names we call them. There were policy measures and there were programmatic measures and there were economic measures trying to address, improve the agricultural production and to improve various related issues. So there is, when we look at India or South Asia or Asia or the global South or the global, the world, everywhere there are exceptions. Some very serious efforts have taken place. Despite that, there are gaps. So the last report of the FAO is indicating several of those issues. So one of the things, I think FAO and the World Food Program, these are the most neutral kind of readings that every one of you are into this discussion should go through. It gives us important kind of statistics and statistical analysis. And of course, there are counters to that. I mean, there is one set of people who say that everything is perfect, and there is another set of people who say that there are several gaps, and a middle ground is also there. So this failures of related to production is something that leads to insecurity. Of course, on the other side, initiatives for food production addresses the food insecurity and leading to food security also. I mean, this needs to be seen from that perspective. Then there are challenges related to food supply. The supply chain of food, including the market that plays around it. All together, the improper systems for storage, preservation, and supply leads to some level of insecurity. So that is where, when Carlo was speaking, it is not just because of one factor. There are several factors that lead to the large animal that we are discussing about, the food insecurity. Then supply chain disruptions are another reason. And market economy and the market interest, and most often when it comes to market economy and profit-driven market economy, the vested interests play a lot of things. So that also leads to the kind of challenge and problem that we are looking at. Then comes the access issue. Poverty, of course, is a major problem that leads to the lack of access to food services and delivery. And inequalities in our society, particularly the design of the governance system, if it is not able to address inequalities and leads to some kind of equitable societal arrangement, the kind of problem that we are facing will continue. So that's another issue that we need to understand in depth. Then lack of access is also resultant of poor civil supply arrangements that the governments are supposed to initiate and fund and implement. Of course, inflation was under discussion when Professor Sukumar was speaking, and price hikes are very critical reasons that impedes access. And there are geographical challenges and related challenges that people at times in specific areas, they cannot access some of the supplies easily, and they have to travel a lot. There are several other reasons that makes it. And then there is something which we need to understand and address. That point I'm a bit highlighting because most of the people sitting here are going to influence this process sooner or later, except a few whose hairs have already become grey. The apathy, the administrative apathy, the political apathy, and the socio-cultural challenges that our society is facing, all these are also leading to the kind of problem that we are facing. Then comes all of these are cross-cutting. The poor governance is cross-cutting, but still I thought I'll put it as a separate pillar. So policies, when they nourish inequalities, the policies need to be examined from whether they are actually helping the people or not. Then how the financing is being done, how the budgets are allocated, drawn and utilized, these all are going to influence the processes. And corruption is one of the key issues that all of us know. And then to counter these issues, we need to have legal and regulatory infrastructure. When that becomes weaker, that adds to the problem. Then one of the major challenges we were talking about is the data systems. The measurable data and objectively verifiable data is absent in our country setting. This weakness is even more becoming deeper these days because we don't have a population level data after 2011. Whatever we are referring to at this point, the census I'm talking about, Whatever we are referring to is old set of data or based on sample surveys. So we really don't have sufficient basing of what we are speaking about. So these are going to form the origins of food security. That's why I'm using myriad kind of words. I know I should not be using it, but for understanding this in a deeper sense, I'm using them. Now, this inequalities that we are talking about is leading to more inequalities. So unequal society, food insecurity, poor health, nutritional, human development, socio-cultural, economic outcomes, they are leading to more inequalities, and this become a vicious cycle. So unless and until this vicious cycle is broken, we are going to face the major consequences in the next generations as well. So that is where this course is, this short course was very important for me. That the realization, the collective realization that we are going to do over today and tomorrow, and the actions that may or that will or that must emerge from this process will have some impact wherever it is possible in several organizations that you are working or the institution that you are studying. It will become a point of discussion, it will become a point of realization, and it will become a point of action. So that part, again, I'm going to come in the next session with the participatory approaches for that. At that point, I'll discuss little later. So there's a conceptual framework that I was going through. This is this is developed in a sub-Saharan African context. But for me, this framework is having a lot of issues. But to begin with, this is a useful framework to look at the health outcome. So let us look at the factors from top. Factors that lead to food insecurity. That will lead to food insecurity. And now look at what are the kind of, there is a nutritional channel to food security that talks about poor caloric intake, diet quality, and nutritional status, and hunger and undernourishment. All these are the nutritional channel. And there is another channel which is mental health channel. This is something not well understood when we are talking about food insecurity or nutrition, because many times we see this only from the physical perspective, and that is how our medical science is developed. Our medical science is not able to see the inside part of the invisible softer part of the human structure. It is all structured around the visible hardware part of the human structure. So from this hardware to software, there is a journey to undertake, and this journey will make us to understand the mental health impact of whether it is food insecurity, whether it is malnutrition, whether it is hunger. As Carlos said, these all are different entities. At times we see this as one, which we need to understand that we need to see them with their grades and their levels separately. But the common thing is that there are these kinds of backgrounds to it. And then there is a behavioral channel. And that behavioral channel, when we talk about the behavioral channel, we at times think about this behavior is a product of individual. That is something that we need to look at and change. The behavioral aspects are coming from several contexts, from all the contexts that we discussed earlier. The behaviors are the outputs of many of these. So it has availability, production related to, availability related to, access related to, all these determine our behavior. And particularly the behavior of the poor who are struggling most of the time. So that is where the poor disease management comes. At times the victim is blamed. So the point that we need to understand is that if we want to address this problem within the framework of the reality of inequality, if we want to address this problem, we need to stand with the victims rather than blaming the victims. That is quite important. So now let us look at what are the next set of products coming, or the outcomes coming from there. So wasting, stunting, and immunological deficiencies, obesity, women's disordered eating patterns, and poor diet quality, many of these things come from the nutritional side of it. And again, from the mental health channel, at times, I'm coming to that specific point. This malnutrition is understood as, at times, malnutrition is only understood as deficiency part of it. So there is something called double burden of malnutrition. So that particular concept we will discuss next. And this double burden quite often is also affecting not only the, one side of it is the kind of over consumption of specific components that make nutrition, and the other is under consumption. Both leads to different types of undernourishment, or both affects the nutrition differently. That may be the best expression to make it. So in that sense, obesity and risks on the cardiovascular and disease acquisition happens to people because of the mental health kind of stress and related aspects. Then comes the behavioral channel, produces compulsion of eating too cheaper kind of food, which is at times very rich in terms of calories and very poor in terms of the other components. So that leads to, so for example, in African and many other settings, the easiest or the cheapest kind of food will be beef and beer. In our settings, it can be different. So for example, in Delhi slums, we did a study, the Public Health Resource Network. One of the things that we found was that the freely available, the biryani supplies and various other things has made the consumption pattern very different in some of these urban settings. And that leads to what we thought was wrong. And the patterns of obesity was going up in some of these places. So these are critically to be understood. So calorically dense and nutrient poor meals, risky sexual conduct, unsafe newborn feeding, poor immunological status, poor access and adherence to medical treatment, all these comes from the behavioral part of it. And this leads to physical and mental health problems, several. Some of them I'm listing down later. And this leads to morbidity and mortality, and this becomes the vicious cycle. So the impact of food security just on the health side, to elaborate that, it's not easy. I can spend at least an hour to speak on each of these issues if necessary. Now let us further look into the consequences. One is this double burden of malnutrition, as I was talking about. The double burden is one, at one side it is the obesity and overweight and those kinds of things, and the other side it is underweight, stunting and wasting and those kinds of aspects. In children, it enhances developmental problems. And it has, as I told, wasting, stunting is there, and it also has this cognitive development challenges. It kind of causes that. It is not the sole cause, that needs to be understood. That's where I'm saying it's contributing, it is adding, it is, that kind of wording. You can see the wording that I picked up. It also causes anemia in women. It adds to obesity, chronic diseases like type 2 diabetes, hypertension, and those kinds of infectious disease, TB, and related. In African settings, it is also HIV and those health challenges. At times, we don't think food insecurity from this health perspective in the way we should look at it. Then the higher, the mental health and adds to the burden of mental disorders. That is another, specific outcome. And then health program and schemes, the enrollment will be very less of those communities who are actually struggling for meeting the ends. So that is another issue. Then indebtedness is a major kind of challenge. Uh, our team members, the who is part of the food security for equitable futures, they have been studying some of these issues, how this effects are happening at the community level. So they're studying in uh, Kanpur, in Unnao of UP, in Goa. So some of these states are studied, and there are several important kind of realizations that is happening. Yesterday, as part of this advisory meeting, we were discussing those findings, and many of these things, many of these points here are clearly talking to those findings. I'll request them to highlight some of them, some of those points little later. Now look at what are the evidence. It's a bit cluttered, but I thought it needs to be like that. And what is coming from Canada and what is not there in countries like India is something that we need to understand, underscore, and change. So this is very interesting kind of these 6 pieces. This is from University of Toronto's. They have a page called Proof, and that proof provides this specific set of information wherein adults living in food insecure households are more likely to delay, reduce, or skip prescription medications due to the cost. And they have made it with population level assessment. 47.1% of people from the severely food insecure population group, they are skipping many of the prescription medicine. Come down, they are dying prematurely also. That is another finding. With data, Carlo was speaking about the importance of that, and he was also talking about the struggle that he is into. Yeah.
By the way, in Canada, they use a version of
Yeah.
that allows you to distinguish between severity.
Yeah. Now, if you look at the second one, is about the second column is about the mental health. The third column is about they are supposed to be admitted to acute care in a health facility for a wide array of reasons. So this kind of a data analysis, unless data is available and analyzed, and the states are planning towards addressing this problem in country like ours. I was looking at one article which was comparing, some of the Latin American countries and India, wherein Kerala has been made as a case study. Kerala of India. This in that specific case study, it is clearly talking about how the data. Only one state in India is able to provide some data. Not that is also not fully sufficient. I'm talking about Kerala. So they have this very specific action plan for the most underprivileged communities. They have the number. The state has planned to reach out to them, and there are specific initiatives on health, on housing, various things, the social support processes targeting them. That is going on. Now, how to have this kind of data is also one of the important issue, because lack of data is also a consequence for me. Because why it is a consequence? Because the development action without data is impossible, and some of the actions will happen only if there is data. So it can be the lack of political will on food insecurity can lead to lack of data. Now, let us pick up some gendered views. Would you like to, both of you come in? How the gendered, impact of food insecurity was seen in some of your studies? Charu, yeah. Can you please very quickly throw some light on that?
So we've been working on a paper to discuss how motherhood as a social construct affects how women are able to access food within the household, and how there are differences in how mothers, these social external social constructs, how women sort of in order to adhere to those norms and expectations, how women are sort of changing the way that they eat. So in our results, we found that women are often eating at last, or sort of sacrificing their meals, skipping meals, not cooking for themselves if the food gets over. So these are a few.
Yeah. The indebtedness related one, if you can very quickly.
Okay. So, hi everyone, I'm Ankita, and
Yeah,
we're
Ankita.
also looking at indebtedness and debt. And I'll just quickly say that, especially in the rural context, and when we think about the landless farmers or the small and marginal farmers, what we are seeing now, and it's more clearly visible now, especially in UP, where you actually, because of the monsoons and these are climate related changes, where you can see lands are all flooded. Sharecropping farmers, because as you all know, they have to borrow, they need to take loans to for food production, which is in fact relevant and important for their food consumption, because they're hardly able to sort of manage enough food to sort of sell in the markets. So when you have all of these agroecological sort of constraints, flooding, crop loss, I mean, what you actually observe is you're actually becoming more and more indebted. You take debt for production and consumption, but then to not being able to pay that debt, you sort of reducing your consumption. But it has gendered consequences, because what we see is young girls and young boys, they sort of drop out of schools, they forego their sort of future prospects for better education, better jobs. So that's one thing. But definitely families are making very, very difficult choices in terms of choosing between food, choosing between education, choosing between building or repairing their houses. So yeah, and I think of course there are, Shemshid, would you like to sort of add in?
So yeah. So here it is clear that women and girls, the global data is suggesting 60 percentage of food insecure population. Uh, they form 60 percentage of food insecure population, and they are facing most of its outcomes. That is how the global data is suggesting, and one third of women are suffering from anemia. And children of all genders, that is where talk about how the midday meals and the anganwadi related programs, how are they kind of getting affected.
We'll speak more about this tomorrow, but just a broad brief about this. So, when families look at schemes, they have their own perceptions about schemes. And when a scheme is about food, as Professor Jasmine was talking about the social meanings of food, so how do these families then look at a school meal? So, we have to look at the intersections of caste, class, gender, religion, to understand how families view a scheme which is decentralized but centrally conceived, has a state plan, state menu. So, do families have problems with it, or do they actually find the meals good? And is it valued based on the content of it, based on the nutritional value of it, or is there a class and caste angle to it? So, everything bringing us to a common point that when we're looking at food, we cannot look at food in isolation. Food has to be seen within the context it is embedded, the structures that sort of shape these experiences, what you eat, why you eat, and what you don't eat and you abandon, and what you wish to share to your friends and families. And it sort of becomes your identity, your marker. So I think what.
Yeah, thank you. So this particular interactions with students and children are something they will reveal the next dimensions of these consequences. Of course, we have more detailed discussions on this, but the important thing is that within children, girl children, because of the cultural norms and various other, they suffer more. And transgender communities and gender minorities are 3 times prone to, the challenges. And geriatric populations of all ages are, and all genders are suffering, but specifically single elderly men are highlighted as, facing more challenges. So these are something, the gendered view of it. And then scheduled caste and indigenous groups, specifically the particularly vulnerable tribal groups. So these specific groups require a lot of attention when it comes to the consequences and related issues. And there are economic and developmental consequences. One is the indebtedness of family, which we discussed already, and the farmers' indebtedness, that goes into less production, and their ability to invest further, and burdens on food, health, and nutrition system also, because of this added burden on the, in the society, the systems also has to do more. That is another systemic kind of challenge. And this also leads to intergenerational health outcomes. So this is something. So we need to see this from a very comprehensive, kind of understanding. This is health, gender, social identities. There are several, elements of consequences when it comes to food insecurity. We'll stop here. Thank you.
So in all the 4 sessions we handled, we didn't give you a chance for any question answer. So anything that you have to any of the speakers, any query, questions, comments, or anything, you please feel free to ask.
Hello, everybody. I'm Diksha. So, the question that I want to put forward is that we have talked about food insecurity and we have talked about various measures from which we can measure food insecurity that the world is facing. But in the face of climate change that is currently happening, so certain other crops do you think can be like cultivated which might help in overcoming of the food insecurity issue that we are facing?
When it comes to the solution side of it, uh, of course, some of those can help, but things need to be seen from a comprehensive perspective. One of the issue that India has been facing, which we talk about when we talk about food security, we were focusing on one specific, grain, which is rice. What we lost as part of it is the food diversity. So it is important that any kind of specific measure that we take, we need to look at this larger ecological and environmental aspects of that also, and how that is going to lead to other consequences. For example, the change of food culture. So how to understand it. I'm not saying yes or no to anything. I'm saying we need to understand it properly and then act on it.
If I may add something, climate change is fundamentally important and we should look at it very, very, very carefully. However, blaming the current situation on as a consequence of climate change is probably not depicting the reality that it is. Because it is true that now there is a chain of impact that maybe asset ownership is the reason why some people are affected more heavily and more directly by the same climate change that is not affecting others. And one thing I noticed in all the presentations, allow me, that you have all been identifying climate change as one of the drivers, but I haven't seen attention paid to conflict. And I think these days, probably, the most urgent thing to look into is how can we prevent the consequence of conflict. And by the way, the things are related because most conflicts are actually fueled by issues that are related to access to resources, water, oil, food, even now, the Ukraine war. But I mean, I don't think that we have a problem of productivity. I don't think we have a problem of potentially not being able to adequately feed the entire world population. Estimates today would say that there is enough food available that we could feed 10 billion people very well. So the main issue is an inequality. And this vicious circle of inequality is what makes climate change much more damageful than it otherwise could or should be.
Thank you. My name is Jasmeet, and I want to ask a question. When we are talking about food security, we are talking just about enough food on the plate. And nutritional security, we look at like as a different image altogether. So, how to actually merge it? And considering the situations of water depletion, there is no groundwater in some of the states. So, how would we grow enough food in the future? And if we are focusing just on enough food on the like enough food for the future, then how will we have that nutrition sensitive food system?
The first immediate reaction is that I tried to say, let's be more specific. And food insecurity is not food consumption. Food security is the ability to access food. Whether or not that becomes enough quality food in the plate is also affected by other things. There is a very recent paper by Edward Frongillo and others that is describing the concept of food and nutrition security versus food security, nutrition security. The important thing is that you have a very clear conceptual frameworks that links all these things, and the one that Raman has shown is yet another example. So I don't think that trying to synthesize food security is enough food in the plate is the proper way to see. Try to distinguish the various steps and links, point where intervention can happen. And so you can combine food security and nutrition security by, depending on the condition, with education, nutritional education, because that might be one of the reasons. Gender empowerment, that might be another reason. Poverty fighting. And so the things are related. But it's not that the public distribution system of rice solves all the problems.
Only one point to add there, because the response looks like, yeah. One, this when we talk about food security, including drinking water security, it should, but the problem comes the actual actors when they act on food security, whether this definitional comprehensiveness is taken up or not is a concern, and that needs to be overseen by the academic community, the people, and so on. So that is one thing. The second part is to see this comprehensively, not only within the framework that you said, it can be seen within the sustainable development and also the climate. So all these together can only address the larger problem. Yeah.